imagine wounds healing faster, naturally, without the need for those complex surgeries or having to take medication for a long time.
Right.
And that's what we're looking at today, the potential of shockwave therapy. We're going deep into its uses for wound care.
Yeah, it's a really transformative field, and we're just at the beginning, of seeing its impact.
So today we're focusing on SoftWave TRT. They're pioneering a unique approach to shockwave therapy. And they've developed this patented applicator that delivers what they're calling a true shockwave.
And that's different from other shockwaves used in the past, like radial or focus shockwaves. SoftWave TRT's true shockwave penetrates deeper, and it covers a broader area of tissue.
And their technology it's already FDA cleared for treating diabetic foot ulcers and burns, two very challenging conditions that affect millions of people worldwide.
Yeah, and chronic wounds are a silent epidemic. The healing takes so long, and there's this constant risk of infection and the potential for consequences that can change your life, like amputation. It's just a massive burden on individuals and healthcare systems.
Yeah, it's a problem that really needs innovative solutions. So how does this true shockwave therapy actually work? How does it do its magic?
Well, essentially, it uses these sound waves, and they target, the body's natural healing process at the cellular level. Like it's like giving your body's own repair mechanisms, like a boost, a super boost.
That sounds fascinating. So can you talk about what's happening at the cellular level? Break it down a little.
Well, think of it as a domino effect. These sound waves, they trigger all these biological responses, and they promote healing. First, there's an increase in blood flow to the area that's injured, delivering vital nutrients and oxygen, and that fuels cell repair.
Yeah, more blood flow, that makes sense. It would naturally support faster healing.
Right, exactly. But it goes beyond just blood flow. The shock waves also stimulate angiogenesis. So that's the formation of new blood vessels. Like imagine you're building new highways to deliver those supplies directly to the wound.
So it's creating a more efficient infrastructure for healing.
Yes, precisely. And then there's another remarkable thing about SoftWave TRT's technology that we'll talk about in a minute.
This is where it gets really interesting, right?
Oh.
What else is happening beneath the surface?
These shockwaves can activate stem cells. Those cells that can turn into different types of tissue.
Okay, stem cells. Now, this is getting really exciting. Just remind me what's so special about stem cells.
Stem cells are like these blank slates. They can differentiate into a variety of cell types, so bone cells, muscle cells, skin cells, whatever you need.
So it's like these shockwaves are signaling the body to bring in these stem cell reinforcements to fix the damage.
That's a great way to put it. And because of this stem cell activation, we're not just seeing faster healing, but we're also seeing a higher quality of healing with SoftWave TRT. Instead of just patching things up, it's actually promoting true regeneration.
That's really promising. It sounds like SoftWave TRT is really at the forefront of this exciting field. And they're not just, talking about it, they're conducting research and getting results. Real results.
Absolutely. One study looked at the use of SoftWave TRT's shock waves to treat second-degree burns. Those are really hard to heal.
Yeah, burns can be so painful and lead to all sorts of complications. So I'm interested to hear more about this study. What did they find?
It was a randomized controlled trial. So patients were randomly assigned to either get standard care for their burns or standard care plus SoftWave TRT. That's the gold standard for medical research, because it eliminates bias and isolates the effects of the treatment.
Okay. So they had a solid study design. What were the outcomes?
They were pretty remarkable. The patients treated with shockwave therapy experienced significantly faster healing. Like on average, their burns healed almost 3 days faster than those who just got standard care.
Wow. 3 days. That might not sound like much, but when you're dealing with a painful burn, I imagine every day makes a huge difference. And that's with just one treatment.
Exactly. And it's not just about speed. Faster healing also means less risk of infection, which is critical with burns.
So it's reducing suffering and preventing complications. That's a big deal for patients.
For sure. And while this study focused on burns, the potential applications of SoftWave TRT's tech go way beyond that. It's showing promise in treating a bunch of other challenging wound types, like...
Well, before we get to those, can you tell me a little more about SoftWave TRT as a company? They seem to be really dedicated to pushing this field forward.
Yeah, they are. So SoftWave TRT is not just doing their own research, but they're collaborating with leading institutions and organizations around the world. We're talking top research hospitals, professional sports teams in the MLB, NFL, NBA, even the UFC.
That's a pretty impressive list. It seems like they're really making a name for themselves in the medical and sports worlds.
They are, and their FDA clearances for specific wound types show how credible and rigorously tested their technology is.
So it's not just about the science, it's also about the commitment to making this technology available and impactful.
Exactly. And one of the things that sets SoftWave TRT apart is their patented applicator. It delivers that unique, true shockwave. We'll get into that in a minute because it's key to how effective their treatments are. That patented applicator is what let SoftWave TRT deliver a shockwave that's, really different from the other devices out there.
Okay, I'm really curious about this. What makes their true shockwave so special? And how does it compare to, other types of shockwaves?
Well, a lot of other shockwave devices use radial or focused shockwaves, and those types of shockwaves, they kind of dissipate quickly, so they limit how deep and how wide they penetrate.
So they're more like a ripple on the surface.
Yeah, that's a good way to think about it. SoftWave TRT's true shockwave, on the other hand, is a unique pressure wave that keeps its energy, and integrity as it goes through the tissue.
So it's more like a surge, a powerful surge that can reach deep into the body and spread out to cover more areas.
You got it. That's why it's so effective at stimulating those biological processes we were talking about before, increasing blood flow, growing new blood vessels, activating stem cells.
So it's like it's delivering this precise and powerful healing message right to the damaged tissue.
And because it can reach a larger area, it can treat a wider range of conditions and wound types.
It's amazing how one little change in the way these shockwaves are delivered can make such a big difference.
Yeah, it shows how important innovation is in medicine. SoftWave TRT is really pushing the boundaries of shockwave technology, and it's opening up all these exciting new possibilities for patients.
And speaking of possibilities, you mentioned that SoftWave TRT's technology is showing promise in other areas besides burns. So where else is it making an impact?
One area that's really exciting is treating skin graft donor sites.
Right. The areas where they take healthy skin for grafting.
Exactly. Healing those donor sites can be, well, it's a challenge. They're basically open wounds that are often big and superficial, which means a lot of pain and discomfort for the patient.
And the longer it takes those donor sites to heal, the higher the risk of infection.
Right. So SoftWave TRT did a randomized controlled trial to see if their shockwave therapy could help these donor sites heal faster.
Okay. And did they follow that same rigorous study design, like with the burn study? Patients randomly assigned to either standard care or standard care plus the shockwave therapy.
Yes, exactly. And the results were just as good. The patients who got shockwave therapy saw their donor sites heal significantly faster, like on average, almost 3 days faster than those who just got standard care.
3 days again, that's amazing, especially when you consider that faster healing also means fewer complications.
Absolutely. For patients going through the process of skin grafting, being able to heal those donor sites quickly and comfortably can make a huge difference.
It's crazy to think that something as simple as sound waves can do so much to help the body heal.
It really shows the power of working with the body's natural healing mechanisms, and SoftWave TRT is really leading the way in this new frontier of regenerative medicine.
It seems like there's more and more evidence that shows shockwave therapy works for all sorts of wounds.
There is, and beyond wound healing, they're also looking at SoftWave TRT's tech for treating musculoskeletal conditions, like tendinopathies.
So things like tennis elbow or Achilles tendonitis, where those tendons get inflamed and painful?
Exactly. The shock waves can bring down that inflammation, increase blood flow to the area, and help repair the tissue.
So it's not just about healing wounds, it's also about dealing with pain and getting people back to normal function in a lot of different conditions.
That's right. And the great thing about SoftWave TRT's technology is that it's non-invasive, there are no drugs, and it doesn't take a lot of time.
That's a huge plus for people who are looking for alternatives to surgery or long-term medication.
Definitely. And as we learn more about this technology, I think we're going to see even more ways it can be used in the future.
I want to hear more about what it's actually like for the patient. Like, what can they expect during a treatment session?
Well, one of the biggest things with SoftWave TRT is that it's non-invasive. So no surgery, no needles.
That's got to be a relief for patients who are already dealing with pain from their wounds or injuries. What's the actual process like?
It's really simple. The clinician puts a gel on the treatment area, and then they use a handheld applicator to deliver the shock waves.
So like a massage, a gentle massage with the applicator.
Kind of, yeah. Some patients might feel a little tapping, but it's Generally not uncomfortable at all.
How long does it usually take?
The sessions don't usually take long. Usually it's about 10 to 15 minutes.
That's pretty convenient. So someone could go in for a quick treatment and go about their day.
That's right. And sometimes patients see improvement after just 1 or 2 treatments, but everyone's different. The number of treatments you need just depends on you and what you're being treated for.
It's incredible how shockwave therapy has changed over the years. It's gone from this kind of niche thing to a real mainstream treatment, and there's more and more evidence that shows it works.
It really has, and SoftWave TRT is right at the forefront of all of this. They're constantly working on their technology and making it better for patients.
It's really inspiring to see companies like SoftWave TRT doing this. They're dedicated to research, innovation, and making sure patients are getting the best care. It's making a real difference for people.
I agree. As more and more healthcare providers start to use this technology, I think we're going to see some really big advances in regenerative medicine.
It's exciting to think about the possibilities. Now, before we finish up this deep dive into shockwave therapy, there's one more really interesting area of research we want to talk about.
Okay, what is it?
This one's about how shockwave therapy could be used to treat chronic wounds. It's something that affects millions of people all over the world.
Yeah, chronic wounds are a major problem for healthcare. They can go on for a long time, and they cost a lot for individuals and the healthcare system. So how could shockwave therapy help with this?
Well, remember all the biological effects we talked about earlier. The blood flow increasing, new blood vessels growing, stem cells getting activated. All those are super important for wound healing.
Right. And we've seen how well it works for acute wounds like burns and skin graft donor sites. But chronic wounds are different, right? They often have underlying things that make them harder to heal.
Exactly. Chronic wounds can be caused by all sorts of things, like bad circulation, diabetes, infections. These things can make it really hard for the body to heal on its own.
So how can shockwave therapy help in these situations?
Well, by sending those sound waves right to the wound, it can help kickstart the healing, even in cases where other treatments haven't worked.
So it's giving that extra boost to the body's own healing system, even when it's struggling. Exactly. And there's more and more evidence showing that shockwave therapy can actually work for all kinds of chronic wounds. Things like diabetic foot ulcers, venous leg ulcers, pressure ulcers.
That's really promising. It sounds like shockwave therapy could be a big change for people who have been dealing with chronic wounds for years, sometimes with other treatments that don't really work.
It really could be. And as researchers continue to look into how this technology can be used for chronic wounds, I think we're going to see some amazing new developments in the next few years.
It's remarkable how simple sound waves can have such a huge impact on the body. It really shows what we can do when we push the limits of technology.
I agree completely. And it's great to see companies like SoftWave TRT leading the way in this field, coming up with new and better ways to help patients.
So to wrap things up, I think it's safe to say that we're seeing a big shift in the way we think about wound care.
Oh, definitely. We're moving away from just reacting to symptoms and towards a more proactive approach where we're actually helping the body heal itself.
And that change could make a huge difference in a lot of people's lives.
No doubt. It's a really hopeful sign for anyone who's struggling with wounds that just won't heal. Chronic wounds can really impact someone's life in a big way.
Oh, absolutely. I mean, we're talking about wounds that they won't heal. Sometimes for months, even years. It's not just the physical pain. There's the emotional side of it. Not being able to do everyday things, the financial burden it can cause.
It's a huge problem, and the ways we treat it now, they often aren't enough.
From what I've read, the traditional treatments for chronic wounds, they mostly focus on managing symptoms, not really getting to the root of the problem.
That's true. We see things like dressings and antibiotics, even surgery sometimes. But those methods, they don't always fix the underlying issue.
So it might help for a little while, but it doesn't really promote healing.
Right, and that's where shockwave therapy is different. By helping the body's natural healing process along, it can address those underlying problems and lead to a real lasting solution.
So it's like giving the body what it needs to finally break free from that cycle of being stuck in chronic inflammation, not being able to heal.
Exactly. And we're seeing some really positive results with SoftWave TRT's shockwave therapy for treating different types of chronic wounds.
Like you mentioned diabetic foot ulcers before, they're notoriously difficult to heal, and they can lead to amputations.
Definitely. Diabetic foot ulcers are a serious problem, and they're often related to poor circulation and nerve damage.
So how can shockwave therapy make a difference there?
Well, remember all those biological effects we talked about. Increased blood flow, new blood vessels growing, stem cells being activated. All of those play a huge role in healing diabetic foot ulcers.
So it's not just covering up the symptoms, it's going after those circulation issues that are often the real cause of the problem.
Exactly. And the research is showing that SoftWave TRT's shockwave therapy can really improve healing rates. And it can lower the risk of amputation in people with diabetic foot ulcers.
That's life-changing for those patients.
It really is. And it's not just for diabetic foot ulcers. We're seeing the same kind of promising results with other chronic wounds, like venous leg ulcers and pressure ulcers.
It sounds like shockwave therapy is giving new hope to people who have been struggling with chronic wounds for years, especially people who haven't had much success with other treatments.
I think so too. It's an exciting time to be working in this field, and I can't wait to see what the future holds as we learn more about how shockwave therapy can help with chronic wound care.
It's amazing how far we've come in understanding how the body heals.
It is, and with technology like SoftWave TRT's shockwave therapy, we're taking advantage of that power in new and innovative ways.
So as we wrap up this deep dive into shockwave therapy, I think we can say that we're seeing a real turning point in how we approach wound care.
Absolutely. We're shifting from just reacting to symptoms to actually helping the body heal itself.
And that's a change that could make a difference for so many people.
I couldn't agree more. It gives a lot of hope to anyone dealing with wounds that just won't heal.
Well said. And to everyone listening, remember that knowledge is power. The more you know about your body and the latest advances in healthcare, the better you can make decisions about your health and well-being. Thanks for joining us on this incredible journey of discovery.